They don't make things the way they used to. Sometimes they make them better. And when it comes to giving you a beautiful smile, that's especially good news. Watch this. We're at the office of Dr. Stephen Marsh. You can find him online at clevelandsmiles.com. A great name for a website.
Thanks, Joe.
Well named. All right, doctor, let's talk about how dentistry has changed over the years and what you and your team can do these days.
Well, so there are a lot more options than when my father was a dentist 50, 60 years ago. And the big change is materials. So today we have porcelains that can cover a tooth. We can do crowns with no metal. We can do bonding. A lot of things that weren't available when my dad was a dentist, for example.
So if we don't like the shape of our teeth or a gap or a space, you can take care of all that for us.
Yeah, and what's very important is we have to evaluate what works best for the patient, financially, investment-wise, and also what we think we can accomplish. And we want something that's going to last a long time.
With no judgment.
With no judgment. So
Right.
here's where we are. How do we move forward?
Right.
And that's what we work with our patients to do.
Let's take a look at some of the patients you've recently helped.
Thanks.
You bet.
So this is April, and April, very friendly person, but she said, I never smile quite as much as I did when I was younger. I don't like the way my teeth have worn down. She was in her 40s, and she said, I really want to take the time to look better. And so in her case, we did 10 upper porcelain veneers. We whitened the teeth quite a bit. She's very friendly, as I had mentioned, and she said, I feel confident the way I used to feel when I was younger, and it's made a big difference in my life.
If you can make a patient feel younger at the same time making them look younger, it's a double bonus.
It's a double bonus.
Yeah.
And especially when she says now when she meets people, she's comes out a little bit more than she used to.
That's
so it's
awesome.
really fun. So Bob, I often focus on upper teeth. We do lower teeth as well.
All I can say is wow.
Well,
I mean, what a transformation. I can't believe it's the same person.
And I tell you, Bob said the same thing when we were done. He had broken a tooth. That's really what brought him into the office.
Those were his bottom teeth.
Bottom teeth.
And those are actually his teeth.
Yeah.
The before picture.
Yeah, and he had, between the teeth, he did a lot of flossing. He had some decay. He said, I don't know what to do. I'd been talking about implants and dentures, and I said, I think we can do a zirconium one-piece bridge, splint those teeth together, and give you a beautiful smile, but also one that's stronger than it's been in years. We did a prototype for him, and then went ahead and did the zirconium bridge. We can even put porcelain between it that's pink in color to make it even more natural, which is what we did with Bob. And he said it's life-changing. And now, not only does he look better, but he can smile in a way that he hasn't for years.
I'm sure he can do everything better. He can eat better. He can clean the teeth better.
He's become one of our biggest advocates,
no
if
doubt,
you will.
No doubt.
Andrew, somebody in his 50s, he said he never really took care of himself the way he liked. His daughter encouraged him to come in. She had seen one of our segments, actually. His teeth were stained, they had worn down, and we actually did porcelain veneers. Joe, this was really what we call a full makeover, upper and lower teeth. We sort of used everything that we had in our arsenal, that's the right word, and did porcelain veneers. We did some gum reshaping with the laser to give him a normal smile, and he said he feels very differently. A big hockey fan, he said now he can go to hockey games and feel good about himself,
That's
smiling.
great. Yeah.
And the last patient's Tracy, and Tracy is a teacher, and I have to tell you, what a wonderful personality. But she said when she got up in front of a class, and she speaks a lot, besides in the classroom, she said, I want a smile that I'm proud of. She had had some bonding, she had worn some teeth down. Over the years, lots of different types of dentistry. We actually did 10 porcelain veneers on her upper arch. And gave her a smile that she said that she's really wanted her whole life.
Well, I'll tell you, if you are watching this and you're thinking, I don't like the way my teeth look, maybe there's a gap or a space you want to change, let Dr. Marsh and his team talk with you and meet with you and show you what they can do for you. Simply give them a call at 440-461-1003 or log on to the website, clevelandsmiles.com. Doctor, thank you so much.
My pleasure, Joe.